Welcome to the third annual Ryan Incubator Elevator Pitch Competition. Feels like every year it gets a little bit bigger. Very excited to have you here. We have a pretty tight agenda, so I'm just going to do a couple of welcome slides. I'm Kelly Ramirez Stone. I'm the director of the Ryan Incubator. I've been in this position for about 3 years. And just briefly, this is just one of many things that the Ryan Incubator does. So if you are at all interested, students, in innovation, entrepreneurship, going in and working in a company and being a change maker from within, this is the place for you, okay? So Kay Ramirez at providence.edu. I'd love to talk to all of you. I am here for you. So this is our agenda. We're going to dive right into the student pitches. We have 12 teams pitching tonight. Each team gets 5 minutes in total for their pitch and for, hopefully a couple of questions from our esteemed panel of judges. Then we're going to go into, the judges are going to leave the room and choose the winning teams. And while we're doing that, and you are going to all have a chance to vote for your favorite team. I'll tell you more about that at the end. And while the judges are deliberating, we're going to have a really interesting fireside chat. And then after that, we'll make the prize awards. And if there's time, you can network. There's great food in the back. I know the teams are probably too nervous to eat, but once you're done pitching, feel free to go grab some food. Just a few notes of thanks. First, I would like to thank the family of Donald Ryan. Donald Ryan is an alum and a very successful entrepreneur. Unfortunately, he passed away, and his family made a gift to the school that has made all of this possible. And his son is with us tonight, Kevin Ryan. And I believe that Helen Ryan, Don's wife, is hopefully tuning in on the live stream. I'd also like to thank the Ann Goss Foundation. They have funded this entire pitch competition, including the $9,000 of prize funding we will award tonight. I would like to thank our panel of judges, Jeff Conroy, who is an alum from 1988, and I'm just going to, I should be wearing my glasses. Jeff is a very successful entrepreneur, and he is the chairman and co-founder, CEO of Embody Inc. Maggie Moore, also very successful entrepreneur who started her career in finance and now is working as an advisor to Boston Community Pediatrics, very involved in healthcare. And finally, last but not least, Steve Sharetta, and he is an attorney and owns his own law practice, class of '82. Finally, I'd like to thank the amazing Ryan Incubator Advisory Group. This is a network of some very successful alums. Ryan Incubator Advisory Group, can you raise your hand, members, so that students can see these are people you definitely want to network with. And Eddie is back there, and I know he spoke to the class where some of these teams are coming from. Most importantly, I want to do a huge shout out to the students who are participating tonight. This is not easy. You have done so much work. I know it. I know how your ideas started and how much progress you have made to get to this moment. So big round of applause, please, for the students. Thank you for taking this risk and putting yourself out there. It's awesome. Okay, let's get started. Judges, can you remind me of the first team? I think it's Remind Me. Haha. There you go. Do you guys want to hold this?
Yeah, can we? I feel like that's fine. Imagine your grandmother. She still lives at home, but she's starting to forget things. One day, she misses her dose of medication. Another day, she leaves the stove on or wanders outside alone at night, confused. This isn't a rare story. It's the reality for over 7 million Americans with Alzheimer's and dementia today. By 2050, that number is expected to reach nearly 13 million. These individuals face daily risks: falls, medication, errors, and wandering that lead to hospitalizations, injuries, and nursing home placement. 30% of people with dementia sustain injuries within a year, and 60 will wander at least once. Families are overwhelmed. Caregivers experience burnout and extreme stress, constantly worrying about their loved one's safety.
That's where Remind Me comes in. Remind Me is an intelligent smartwatch designed specifically for people in the early stages of dementia that sends information to an app that can be monitored by caregivers and family members. It tracks heart rate, blood pressure, sleep patterns, fall detection, and uses GPS technology to alert caregivers and emergency services if the watch user wanders outside the designated set area. But what truly sets it apart is its voice assistant feature, a friendly, simple companion that reminds users about medications, appointments, and daily tasks, helping them maintain independence safely at home. There are existing solutions addressing parts of these issues that individuals with dementias face. However, as you can see, Remind Me goes further than all of these other options, integrating all of these functions into one accessible HIPAA-compliant device. It is not just a safety tool. It is a companion that empowers users and eases caregiver stress, all while relieving the burden on the healthcare industry.
Remind Me will operate as a social enterprise, blending technology and healthcare innovation to drive both social impact and financial sustainability. We'll generate revenue through device sales in a subscription-based platform. This provides real-time data, alerts, and support. Initial funding will come from grants and innovation programs, including partnerships with the Alzheimer's and Bright Focus Foundations. As we scale, we'll expand through collaborations with insurance providers, hospitals, and memory care clinics. Our pilot program will launch through partnerships with memory clinics in the greater Boston area, allowing us to test, refine, and validate the product's safety and usability. From there, we plan on expanding nationally through healthcare networks and senior living organizations, focusing on affordability and accessibility, especially for rural and low-income communities. For us, success means fewer hospitalizations, reduced caregiver burnout, and most importantly, enabling people with dementia to continue to live independent, dignified lives at home for as long as possible. Thank you.
Today, we're asking you for your investment in us so that we can grow and create partnerships with senior living centers and people with expertise in developing apps and AI, as well as knowledgeable advisors to form an advisory board that will guide us through this journey. Thank you.
All right, I got a question for you. You mentioned it was a subscription-based service. Family member has dementia that's not connected with their family. How was that handled?
So when planning on partnering with senior living organizations and memory care clinics, we plan on having the clinic able to buy the subscription, and then they can give it to patients through their billing programs.
But also individual families can have a subscription on their own and then use it with their mother or father or whoever has dementia.
Great job, guys. Talk to us a little bit about the partnerships that you're going to go after, and who are they, and how do they tie to your ability to generate revenue?
We need to start building the apps. We want to work with software developers and go from there, but also just to start the first phases of building the watch, we want to work with memory clinics so that we can make the best app and watch possible to support the needs of dementia. And I think the memory clinics working with actual individuals, and being able to do tests will be the best way to go about that.
We also were planning on going to these memory clinics.
Sorry, I have to cut you off. Sorry. Great
okay. That's
job.
okay.
Great job. Next up is Healthcare Compass.
Hi, I'm Emma,
I'm Salam.
and my name is Ethar, and today we're going to be pitching the Healthcare Compass app for you. Is it on? Is it on? Okay. And today we're going to be pitching the Healthcare Compass app to you. So we first wanted to start off by talking about why this idea matters to us as a group. When I was 12 years old, I was diagnosed with leukemia, and before my diagnosis, I had to spend what felt like endless hours in emergency rooms to figure out what was wrong with me. And even after the diagnosis, when I was listed as a critical care patient, I still had to spend so much time in emergency rooms. So that experience really made me question, why does the emergency room have to feel like this? And why do people like myself, when I was a kid, have to experience that? So from that personal experience and the many experiences we know our families and friends went through, we realized that we needed to make emergency care more accessible for everyone. And that's where Healthcare Compass comes in. Adult emergency use has increased from about 17% to 22% over the past 2 decades. And after the pandemic, staffing shortages and limited outpatient availability have made this problem even worse. So without better tools to guide patients before they arrive at emergency care, these challenges will only continue to grow.
And that's why we came up with this idea. It'd be a nonprofit, public health focused mobile app designed to address the entire care navigation app. We want to build the app to help people understand where to seek care, when to seek it, and what facility best suits their needs. It will function as a guidance and navigation tool, helping distribute patients across the healthcare system. First, it would include a system-based search engine that lets users enter what they're experiencing, and the app would guide them toward the right level of care, whether that be the ER, urgent care, primary care, or even safe home management. And to make that guidance truly useful, it would also pull real-time data from hospital systems and urgent cares, showing live wait times and capacity so people aren't making blind decisions. The app would then match users to nearby facilities that accept their insurance using GPS and insurance information to make navigating care easier and more equitable. And lastly, it would include educational tools. This helps people understand the difference between emergency and non-emergency symptoms, giving them the confidence to make safer decisions.
So here you can kind of see a comparison of our competitor apps like Buoy Health, like Solve Health, and ZocDoc Health. However, it's very clear from the chart that our app would be able to give you the symptom checker, give you live ER wait times, map your insurance in GPS, as well as determine whether your condition is emergent or not. And though Buoy Health does have 2 out of the 4 features, they don't have that real wait time ER type feature that definitely makes our idea unique. And with all of that being said, Healthcare Compass can be used by patients, hospitals, urgent care centers, and public health agencies. And these connections would reduce wait times, they would relieve crowding of ER facilities and others, and give that real-time data to agencies. So to make all of this possible, we intend to secure funding from partnerships with health systems like Brown Health and Leahy Health, as well as grants and innovation accelerators. And really at the end of the day, our whole point of this is that nobody deserves to experience the wait times and the nightmares that really happen in the ER. And we hope to create a future where people can access proper care at the proper time.
So today we are looking for mentorship and partnership. So I don't know if we have enough time for questions, but
If you guys have any questions, please let us know, and you can also email us.
Great job. Thank you for sharing this. So you talked a little bit about working with healthcare systems and partnerships. So is that sort of how you think about bringing this to market as something that's for the business versus for a consumer to use, or how do you see that actually happening?
So this would be for like any consumers, like any individual that is looking for help when deciding for the whether to go to emergency room. With the partnership aspect, we would partner with like healthcare systems, like the ones that you listed, but like that would allow us to implement the wait time,
Right.
like tool. So we would partner through them and then be able to like estimate what the wait times are in their ERs.
And how do they get that? Like, how does that data come into the app?
So we were actually brainstorming this, but we were thinking of using, we were researching how paramedics, they have like trackers and their capacity, so something of that sort.
Great.
Terrific, ladies. Maggie, you asked the question I was going to ask. Are they done? Okay.
5 minutes, sorry. Sorry about that. Oh, great. Okay, next up is Tailored. Sorry.
Hello. Hi. My name is Michael Pizzullo, and I'm the founder of Tailored. Tailored is a seamless shopping companion as well as precision sizing system. By a show of hands in here, how many of you have ordered clothes in the past few months and were frustrated when it came in the wrong size? Terrible, right? My statistics show that 30 to 40% of all online retailers are returned based on poor sizing. This is a $100 billion annual problem in the United States alone. Very big graphic here that shows up. So what's my vision? My vision is Tailored, the company and a B2B software as a service platform to mid-sized retailers. What is it and what do? You take pictures on your phone, and from there, it detects your body composition, your limb ratios, and your proportions. And from there, the AI assistant Tailor understands you, your fit, and describes why each size fits for you. So how does this compare against the competitors today? Well, nobody is targeting mid-sized retailers currently, as well as there's no quick AI integration that's with them. There's no AI assistant as well. So how are you going to know and chat with an AI companion that know what size you are? So how am I going to scale this? I'm going to reach out to Vineyard Vines and Talbots. Combined, $26 million is held annually in reserves for poor size and fitting. This is insane because they're allocating so much money instead of just making a consumer-based product for them to use. So to get this started, to build my MVP, I need $25,000 to $80,000 to build the AI infrastructure, as well as chatbot designed for the consumers, as well as connections to these mid-sized retailers and connections to investment firms. Thank you guys so much, and today we can make precision sizing happen. Any questions?
How do you present or prevent my body image from being sold or stolen?
Very good question. So there's UX insights and laws that will be analyzed to try to prevent this and not afford for data breaches. So once they're piloted and once that these two brands show growth, then we can do it into an individual app and provide more security there.
All right, good job. Talk to us a little bit about what you hope to generate in revenue and how you're gonna establish your customer relationships.
Yeah, good question. So these two brands are very essential in the Northeast, and I feel like if I can provide them with enough insight and enough value to them and cut down on their returns, at least 25%, there'd be getting a lot of looks at this. So I feel like it'll be a huge progress to these two brands, and then they'll get a bigger consumer page from there.
Good job. You good?
Thank you all.
Next up, Vital Gown Pro.
Hi, everyone. Thank you so much for being here. We are Team Vital Gown Pro. Imagine someone you love, your mom, your dad, your grandparent, in one of the most vulnerable moments of their life. They're sick, they're tired, and they're scared, and they're asked to change into a traditional hospital gown that strips them of their privacy, dignity, and comfort at the exact moment they need these things most. Imagine you in that position. How would you feel? A startling 70% of patients reported poor fit, and 72% reported feeling exposed in the current hospital gown. This gown sends a message before vitals or any tests are taken that you are sick, you are dependent, and you are no longer in control. For many, this becomes a mentality, shaping how they see themselves, how they heal, and how they spend their final days with the people that they love. But what if the simple act of getting dressed could do the opposite? What if a gown could offer dignity instead of taking it away?
This is where our product, Vital Gown Pro, comes into play. Our product is a redesign of the traditional gown built around 3 basic principles. These principles are dignity, clinical comfort, and seamless monitoring. With the traditional gown, patients are left feeling exposed with their outer back shown. This leaves them feeling vulnerable and undignified. Our gown, on the other hand, provides full coverage through side wrapping panels with adjustable straps. This maintains comfort as well as full clinical access for physicians. In addition to this, our gown includes discrete pockets and channels for the integration of wearable technology. This enables continuous, uninterrupted streaming of vital signs to the front nursing station, which prevents them from having to disrupt patients when they need their rest most. These pockets also secure the device in a fashion that eliminates the need for dangling wires or messy tape jobs seen in today's healthcare. By combining comfort with technology, the Vital Gown Pro supports better rest, better monitoring, and a far better patient experience, all while making clinical workflow easier, not harder.
But why Vital Gown Pro? Traditional gowns fail to deliver comfort and advanced technology. Biotricity provides that advanced technology, but lacks a way to deliver it. Care and Wear and New Gown provide a full coverage, comfortable hospital gown, but lack advanced technology and snap-free convenience. However, Vital Gown Pro meets all of these essential features. Vital Gown Pro provides patient dignity, provider efficiency, and advanced technology all in one product. It improves patient comfort, creates a better workflow for providers, and limits the sick role. Vital Gown Pro is setting a new standard for patient care attire.
So our business model, we're going to operate as a for-profit LLC, operating as a B2B company. This means that we'll partner directly with long-term care facilities and hospitals. And this type of structure will allow us to seek mission-aligned angel investors and venture capital firms like SV Health Investors, known for supporting medical device innovation and patient-centered solutions. And then as far as our scale strategy, we'll pilot right here in Rhode Island at Hope Health Hospice Center, where we'll collect data, track outcomes, and get to refine the gown based on real-world results. And then once the pilot proves successful, we will expand across Rhode Island and then plan to scale regionally and nationally.
Our ask of you today, if you believe in our idea, is to provide us with any mission-aligned angel investors that you might know, any connections to technology companies that you believe would be interested in a partnership, and facilities interested in incorporating and trialing our gowns.
Great job, guys. Have you spoken with anyone directly in the health industry, nurses on staff, to suggest the concept of a gown that doesn't open in the back? And is it as easy, easier, or not as easy?
So one thing we talked about is how our gown would be reversible. So if somebody had an incision or something that needed to be monitored on the back, they could switch it around so those ties would be easily accessible and so that they could have that open back access if they need it, but it would still have the flaps over it so it would provide the full coverage.
We also talked with one of our own, Lou, right here, who's worked in health administration for a while, and he talked with us about much of the. Are we done? No.
Good evening. My name is Kayla McCaffrey, and I'm here today with Tyler Bartlett and William Johnston to talk to you about Preva Health. I was working my ordinary Friday night EMT shift when a call to Apex Nursing Home came in, which sprung my ambulance squad into action. My patient Jean was walking to her room when she suddenly tripped and fell. When we arrived on scene, she was on the phone to her family, who was miles away. We rushed Jean to the hospital, where she spent time recovering from a hip fracture. Unfortunately, nursing homes face this problem frequently. In fact, 50 to 75% of residents fall annually. These accidents are incredibly costly to the nursing home. One fall can cost the care facility $30,000 to $50,000. Even more, care facilities face detrimental staffing issues. The turnover rate for registered nurses and certified nursing assistants is 50%, and the cost to replace just one RN in a care facility is $40,000 alone.
So what's the solution to these problems? A solution is Preva Health. We use off-the-shelf wearable devices which feed live health data into our AI predictive platform to empower nurses to make data-driven decisions. And it's not just about the data. It will act as a force multiplier for the nurses, allowing one nurse to effectively monitor 20 patients instead of 5. Here you can see a mock-up we've made of our dashboard. All the residents have risk scores listed, and it will automatically flag residents as high risk for falls and will alert staff. And our platform will also allow nurses and staff to see residents' profiles in further detail. For example, a fictional resident, Mary S. You can see her live biometric data and a 48-hour fall probability that's calculated by our platform. So along with our predictive algorithm, this will all be right at their fingertips, allowing nurses to treat illnesses before symptoms occur, going from reactive care to proactive care.
When we look at the competitive landscape, Previa stands apart. Safely U relies on cameras and only monitors bedrooms, offering little predictive insight. Care Predict uses expensive proprietary wearables and relies on facility-wide beacon installations, making it costly to scale. Philips uses reactive technology limited to beds and chairs. Previa is the only solution that uses off-the-shelf wearables, requires no installation, monitors residents anywhere in the facility, and delivers true predictive capabilities. This gives us lower costs, easier deployment, and a fundamentally better clinical outcome.
And as for the total addressable market, there's currently a silver tsunami occurring. Over 85s are the fastest growing age group in the United States, and the over 65 population is expected to double by 2060. This marks a major opportunity for software to support this cohort's retirement and transition towards living in long-term care. The market for long-term care software, in fact, is projected to grow by 10 to 12% per annum for the next decade. So our business model and our asks. We're a B2B SaaS company. We we plan to sell subscriptions to our software platform to long-term care and aged facilities, scaling throughout the Northeast and over the United States. As a software company, we will scale quickly, taking advantage of this explosive growth in the industry. To achieve this and bring Previa Health to market, we're seeking $250,000 to help secure a lighthouse partnership with a mid-market, forward-thinking, long-term care and aged care firm to help fund the development of a proof of concept prototype platform. Thank you. We'll take any questions you have now.
Great job, guys. Tell us a little bit about the differentiation. So you talked about the competitors. What's the number one unique thing that you're going to bring that doesn't exist today?
We get ahead of any falls or any injuries or any illnesses. All of the other technologies, they're all reactive, right? Like if you have cameras, it can only help after someone's fallen over. With our taking biometric data from these wearables, we can get ahead of it. We can predict before it's going to happen someone who's more likely to fall or be injured.
Safe mother patch.
Around the world, children grow up without their mothers because of preventable disease that often goes undetected. This summer, I spent 5 weeks at a rural health clinic in the remote village of Vizale in the Solomon Islands, where every Tuesday morning nurses held antenatal clinics to treat women in the community who were pregnant. These women walked 2 hours each way to get care, often only getting checked once during their entire pregnancy. Preeclampsia, also known as pregnancy-induced hypertension, is a severe maternal health complication categorized by high blood pressure after about 20 weeks of pregnancy. Without detection and treatment, preeclampsia can escalate into multi-organ failure, affecting both the mother and her developing fetus. Preeclampsia affects 15% of pregnancies worldwide, leading to 40,000 maternal deaths each year. Preeclampsia is easy to detect, but if you're only getting checked once during your entire pregnancy, your symptoms are going to go unnoticed. Early detection of preeclampsia will save countless lives.
Some companies have attempted to develop early detection devices, such as wearables or programs with at-home-based blood pressure cuffs. But these are costly, they require medical literacy, and they still depend on the doctor's interpretation. Women in remote or under-resourced areas are often left without monitoring. So, we developed the Safe Mother Patch, a wearable and reusable tool that tracks preeclampsia-related factors, specifically swelling and electrolyte sweat level changes, to alert you of increased risk from anywhere in the world. Capable of working offline, the patch will allow those in low-resource areas with no medical knowledge to know to detect symptoms by simply watching for a color change. If the patch changes colors, you know to go to the doctor sooner than planned, which will lead to getting access to treatment earlier.
As a nonprofit enterprise, our goal is to make the Safe Mother Patch accessible for everyone. We will work with insurance companies to ensure coverage through provider-based referrals, and for those without insurance or in low-resource settings, we aim to subsidize costs through grant funding and philanthropic support. Our next step is to test the patch in a low and a high community. A rural community in Belize, where Providence College sends medical brigades, and here in Providence, where patients have access to nearby clinicians. By comparing the outcomes of a two-phase trial, we can determine the success of our device across differently resourced settings while we work towards FDA approval.
Many nonprofits, such as the Preeclampsia Foundation, the Society for Maternal Fetal Medicine, and Better Health for Mothers, can support education, outreach, and implementation for our innovation. Private sector collaborators, including digital health companies and medical device manufacturers, will be essential for refining and distributing our technology.
In order to bring the Safe Mother Patch to the next stage, we're asking for your help. partnering with biochemists who can do research on biomarker detection, biotech companies that can help develop our first prototype, and funders and stakeholders who believe in making a difference in women's lives. Let's bring the Safe Mother Patch to the next stage and change the future of maternal health. We're happy to answer any questions.
Okay, the guys can ask questions too. I love this topic. It's something I spent some time on in my career as well. Great job, ladies. One question is why set up as a nonprofit versus a for-profit? Just start with that.
A lot of the companies that we were researching into for partnerships were also nonprofits, so it seemed like a better collaborative opportunity to work with them. We also did meet with a doctor and a nurse who work in this field, and they definitely suggested approaching it from a more philanthropic angle, especially because our goal is to make this accessible not just to women in the United States, but really on the worldwide scale. Yep. So it's easier to get that partnership with like the United Nations or the World Health Organization if we're also a nonprofit.
If the patch changes color, how long does the person wearing the patch have to get to the hospital?
So the recommendation is that if the patch changes color, you would increase your fluid intake for 24 hours and then put on a different patch and see if it changes color again. So this would eliminate false positives. But ultimately, the conversations that we had with the medical professionals was that over-detection was better than under-detection. So if it's changing color, especially in these places where it takes 2 hours to get there, the quicker you get there is better than not getting there at all. So the recommendation would be reassess after 24 hours and then come back if there's still an issue. But again, there's not like such a specific timeline. It's more just increasing the prevalence that you know there's a problem faster.
Hybrid Health Journal.
Good evening. We're excited to share our project with you tonight, the Hybrid Health Journal System. Our team, Sam LaRanger, Sam Casey, Sean Maloney, and myself, Colin Sheehan, designed a simple, scalable tool to close a major communication gap in geriatric healthcare.
We start with a show of hands. How many people have ever helped an older relative use an app? Frustrating? Yeah. It can be hard. It can be very difficult for an elderly person to use a mobile device, computer even sometimes. My grandmother has a lot of trouble with email. So imagine asking her to use MyChart, something that takes a lot of skill to use, not exactly the most intuitive, and try to order medication, do some of these harder healthcare tasks that if she can't figure out email, it's very hard for me to be able to trust that she's figuring out how reliably to get medication and report symptoms back to her doctor. We know that data tells us that the age group of 75 and up reports communication with doctors to be the most difficult thing in their healthcare journey. So we came up with a solution to help that communication gap go smoother.
Our solution is the Hybrid Health Journal System, a tactile paper-based journal that older adults already feel comfortable using. Patients can write down symptoms, medication changes, and other questions in their own writing. What makes this powerful is the QR code at the bottom. A caregiver or loved one can scan and upload this into the EHR. It bridges the gap between the way older adults prefer and the digital infrastructure that providers rely on. It's a simple, secure, HIPAA-compliant way that removes pressure for seniors to learn new technology and keeping their doctors informed.
I'll quickly touch on our competitors. Some healthcare providers have similar tools, but none of them transcend to a paper part. So they have kind of virtual notebook systems, though that doesn't solve the problem of not giving the elderly patient something that they know and is intuitive to them. That's what we try to do with a paper journal that is tactile, environmental friendly, and HIPAA compliant as it stays with them and a caregiver uploads pictures into the EHR.
So we have a three-sector approach. First, with people, it improves communication between the patient and the provider, and this overall allows providers to catch issues before they occur, which is a big issue for geriatric patients because readmission is a big factor when it comes to geriatric care. And second, for the planet, our model proves that it uses printable, sustainable materials, reducing waste, and with that, reducing waste through the removal of duplicate documentation, as is very common in our current healthcare delivery system. Third, for profit, it aligns well with value-based. Better communication leads to better results. And overall, our model is low cost relative to other products available on the market.
We're not asking for any huge funding today. We're looking for the right partners to help bring HHJS to life. First, we'd love to connect with geriatric clinics and home health agencies willing to pilot the journal to a small patient population. We're also seeking to collab with electronic health record and IT teams who can help us refine the QR upload workflow and ensure seamless integration. And finally, we're looking to partner with organizations on healthy aging and value-based care so we can measure real outcomes and scale responsibility. Together, we can build a tool that makes communication more human, more accessible, and more effective for older adults. Thank you.
Great job, guys. So my 96-year-old grandmother, who absolutely cannot handle an app, she can't handle call waiting, so we know the app's a problem. So she's going to take this paper and she's going to fill it in, and her caregiver is going to flash the QR code, except she's got arthritis and she doesn't write very well. So how does your system take her chicken scratch and make sure they're getting the right information?
The system would have an AI component that would read and transcribe the words into the correct places of an EHR. We don't have a picture of an EHR here, but there's all different parts of it, right? And so even with chicken scratch, there is plenty of good AI that's pretty good at doing this now, and it's only getting better. So we have high hopes. Thank you. Thank you.
Smart consent.
Imagine this. You're about to sign a medical consent form for a surgery. It's 22 pages long, written at a 12th grade reading level, and full of terminology clinicians themselves don't use aloud. Now, imagine English isn't even your first language. You're scared, stressed, and in pain. This isn't a hypothetical. This is healthcare in America.
Informed consent should protect patients, not confuse them. It should build trust and not create barriers, and it should be understandable for everyone, not just those who can read at a college level.
Informed consent documents continue to remain dense, technical, and inaccessible. This is not informed consent. This is a barrier to equity and a liability.
Smart consent is here to fix that. By redefining what it means to be truly informed, we're ready to bring healthcare into a more ethical, accessible, and equitable future. So Smart Consent is an AI-powered platform that transforms this dense medical and research consent documents into understandable and personalized explanations. It does this by tailoring consent to adjust for literacy and language with an interactive Q&A to further support comprehension. It would also be integrated into workflows by uploading patient histories. This works to not only benefit patients, but providers by alleviating burden and improving the quality of care. As you can see, what sets Smart Consent apart is personalization. While others do make consent digital, we work to make it understandable.
Our projected market size is 1 to 1.2 billion, which is where the global e-consent and healthcare market is projected to reach by 2032. Our initial markets are clinical research organizations, as well as hospitals and surgical departments. We begin as a for-profit platform, eventually extending a nonprofit arm for open access health literacy tools. Our funding would come from government grants such as the NIH and NSF, as well as healthcare angel investors for software development.
Smart Consent would make a consistent revenue flow through investment into our software. For example, subscription would need to be purchased and then continuously renewed. Scaling decisions would be a pilot phase approach with a control and experimental group piloted in Boston Medical Center. In this location, 73% of their patient population is from low-income areas. It would also be centralized in a minimally invasive surgical department. After validating its gains, Phase 2 would expand Smart Consent into multiple hospital departments, clinical trial settings, and eventually integrate for automatic patient uploads from the electronic health record system. Smart Consent is built to scale because the problem is urgent, universal, and large.
Our team would consist of AI engineers, software developers, clinical ethicists, and health literacy specialists, compliance expertise, as well as patient advocates. Today, we are seeking pilot partners, advisory board members, and startup funding to complete product development and IRB-aligned testing. Thank you.
A little bit about how much you need to raise to build your first product, enough to be able to get it into the pilot and have something that you can talk to partners about.
Yeah, so basically our ask right now is to really just develop our team. We're looking to partner with these members just so we can get a better idea of how much will really need to be invested. That's why we kind of want software developers to really understand what this product might look like. Then we can really assess what the cost might be.
With a lawyer sitting next to me, based on, say, you've got a reading level of 5th grade, how do you adjust that medical terminology to satisfy the lawyers?
So the AI we would upload the consent form, and it would be based on the literacy level of the patient. So what's different about ours is you would get a new tailored consent form as well as videos, but what makes ours special and personalized is that Q&A. So obviously if you have a younger patient, you know, you have the parents there, but the importance is tailoring. So we're tailoring to the younger patients. With that personalized Q&A after, it's an understanding. Did you understand what you read, what you saw? Obviously for a younger patient, this is also a targeted area. So that follow-up Q&A is what really personalizes us.
Plate check.
Hi, everyone. This is Plate Check. Sorry. Hi, everyone. This is Plate Check, which creates safe and healthy dining experiences for everyone on college campuses. My name is Nadia Rozecki, and for me, eating on campus isn't just about choosing something that looks appealing, it's about being safe. I live with a severe chronic illness called mast cell activation syndrome, which causes severe allergic reaction type symptoms to even the smallest traces of the wrong foods or ingredients. Last semester, I had to take a medical leave of absence, and the only strategy that helped stabilize my symptoms was eating a controlled and restricted low histamine diet. Upon returning to campus, I observed that our dining halls lack access and transparency to
nutritional facts, including complete ingredient lists and macronutrients and allergen information. This not only poses a lot of uncertainty and anxiety for individuals, but it also creates a great risk because it directly influences the health and safety and well-being of individuals as well as our performance. Did you know that 20% of the United States youth have been diagnosed with a chronic medical condition? Additionally, 11% of college-age students have been diagnosed with a food allergy. Of that 11%, 42 to 63% have reported that they've experienced an allergic reaction while enrolled in college. So not only is this affecting me, it's affecting thousands of others.
During my internship at the Harvard T.H. Chan School of Public Health in the Department of Nutrition, I learned just how important and critical precision nutrition is. It is not just about providing healthy information to people. It is about providing it at the right time, at the moment, and provide the filters that they need for their specific dietary needs, just like Nadia. So our solution is to propose a pilot app called PC Plate Check, where students can access information and filter it based on their specific dietary needs. They can meal plan in advance to ensure that each of the items that they're gonna want to eat are safe for them and are not putting their health at risk. So other apps like MyFitnessPal and NutriSlice offer generic menu information and like not that broad, like specific nutritional data. So PC Plate Check is gonna specifically provide symbols for the students of allergen so that they can have precision nutrition based on their own specific health needs. It will also allow us to personalize it to different institutions, just like at PC. And we will provide a feedback loop with dining staff. So there was like cross-contamination in between some products, like the students will want to know if they're gonna be able to eat that food without posing their health at risk. And it will also provide us to get direct partnership with dining companies just like Sodexo, who does not only provide food for students at PC, but also partner with other bigger institutions and all colleges and universities. So our business model will be a B2B model, and we will start with a pilot app at PC, and then continue and expand it to other universities, and eventually expand it beyond the sector of colleges to hospital, nursing homes, and other corporate dining programs. So our ask is to get a team of development collaborators and investors to be able to build the full app. And we also need market experts to ensure that the nutritional data that is going to be available to students is precise and accurate. So thank you so much. And if you guys have any questions, please let us know.
Good job, guys. Talk to us a little bit about the risks, the type of risks that come when you don't have this information and why it's so important.
So the reason that complete ingredient lists are important for people with chronic illnesses or allergies or food intolerances is that because sometimes the foods that are served at the dining hall can have specific ingredients that can pose a reaction. So for me, low histamine is really important, and ingredients in sauces, for example, have certain preservatives and additives that can cause a reaction that aren't listed in the name of the dish.
Good job.
Quietly.
That's distracting, right? We can agree. That's distracting. Well, imagine this. You're in a quiet room, one just like this, and your alarm goes off. Everyone turns and looks at you. You try to silence it. You're embarrassed, even though all it was doing was reminding you to take your medication. For millions of people living with chronic illnesses, this moment doesn't just happen once. It happens every day. And it's not just awkward or embarrassing, it's dangerous.
Medication non-adherence is one of the biggest challenges in healthcare. A study done in the US showed that nearly 50% of patients with a chronic illness are not taking their medication as prescribed. That then leads to a worsening in health conditions, preventable hospitalizations, and an estimated $100 billion in unnecessary healthcare spending. Even patients who do want to take their medication on time often struggle. Among populations in the US, medication adherence is lower. Around 63.1% of patients report forgetting their medication as the main reason for missed doses. Traditional reminders like pill boxes, smartphone alarms, as we see, or bulky dispensers do not fix this problem. In fact, they create a new one, stigma. They're visible, intrusive, and they even remind you and the people around you that you are sick. What people want is a solution that is blending into their lives. What they need is a reminder that feels empowering, not embarrassing.
And that's why we're introducing Quietly. Quietly is a wearable that does just that. Our innovation is a discrete medication reminder jewelry line that pairs seamlessly with a mobile app. Instead of the obnoxious alarms like the one you just heard, Quietly provides gentle vibrations through bracelets, rings, and necklaces that are subtle enough so you can maintain your privacy in public, but also noticeable enough to stay on track with your medication. Our innovation is backed by behavioral science. A study in the US showed that medication adherence works best when it is behaviorally integrated into your day-to-day life. In other words, people are more likely to take their medication when reminders are natural, fit into their daily routine, and are backed with information and support. Unlike existing tools such as MediSafe apps or smart pill bottles, or even more mainstream products like Apple Watch or Oura Ring, Quietly is discreet, stylish, and stigma-free. It is purpose-built for invisible, intentional medication support through daily reminders that avoid a breach in privacy.
We are a for-profit company with a target market of women aged 18 and up, focusing on individuals who value privacy, style, and control over their health. With our wearable medication reminder jewelry, we are asking you to join our movement to make medication adherence private, beautiful, and empowering, because taking care of your health should feel like taking care of yourself.
Thank you.
Nice job, ladies. So when you think about the target market, you talked about women aged 18 plus and presumably women who have chronic disease. Is that?
So
It's actually our favorite question.
A big topic within our market is birth control reminders. A lot of women have to take birth control on a daily basis, either for a lot of different reasons, and a lot of women often forget, and that can pose a lot of challenges in their day-to-day life and their health. And this is a way to not broadcast to the entire world that they need to take their medication, but to keep women on track and to keep women healthy.
Yep, get the solution. So how many women is that? Like a million, 10 million? Do you have a sense of the scale?
Well, as of now, we don't have a sense of that scale, which is why our target age would be anywhere from 18 plus,
Yep.
which is, we're not limiting it just to whatever we don't know the amount of like women who are currently on that medication. But our main target is to focus on minimizing stigma and just dealing with the population size of 18 plus as of now.
How does my medical information get uploaded to my device? Who's doing it?
So it's paired seamlessly with an app. So you upload your the medications that you're taking and what time you want to take it, and then the app connects with the jewelry to set those reminders, so you don't have to go on an app every time you need to take your medication.
Thank you.
Smart RX.
Good evening. Good evening. Tonight I will be introducing you to a product that is going to revolutionize the geriatric pharmaceutical industry. Over the summer, I worked at a podiatrist's office. We're a private practice, so I often cannot access a patient's full electronic health records without contacting a primary care provider. Therefore, I often had to manually update medication lists after each visit. Initially, I found this task tedious until a regular patient came in and shared a recent diagnosis where they couldn't recall the names of their new prescriptions. In that moment, my frustration turned to empathy as I realized how overwhelming it must be to manage numerous medications without fully understanding them. When patients aren't able to keep track of or understand the uses of their medications, there's a great potential for over or underdosing and having potential adverse drug effects. In fact, in the US, adults aged 65 and older, the prevalence of polypharmacy, for if you don't know, is the simultaneous use of 5 or more drugs at a time, has been increasing. The rate has gone from 31.4% in 1999 to 35.8% in 2011. That is why our group has come up with Smart RX. This product will be automated, similar to an alarm clock, to notify users at various times throughout the day to take their medications. Additional features include glowing indicators for individuals with hearing loss, vibration options for those with vision loss, locking compartments, which will be installed in order to avoid accidental double dosing, and then what differentiates our product from other products on the market, as you can see, are that there will be a glossary of pills they're taking and reasons for taking them.
Our multidisciplinary team, spanning pharmacology, geriatric care centers, software developers, and engineers, will ensure a comprehensive approach to design and safety. Marketing will target not only seniors, but families, caregivers, and healthcare facilities who often assist with purchasing decisions. To ensure sustainable growth, we'll pursue capital investments from healthcare technology firms to support ongoing innovation and market expansion. Strategic partnerships with healthcare providers, such as CVS or Pfizer, will help strengthen distribution and ensure alignment with safety and labeling standards, and allow SmartRx to reach patients directly through trusted medical channels. Our goal is continuous improvement to open the conversation and better meet consumer needs. During the pilot phase, we'll collaborate with pharmacists and manufacturers to develop the product based on research and expert input. A gradual rollout is essential as we are dealing with a vulnerable population. Rushing production could lead to medication errors or overdoses. We'll begin implementation in senior living facilities here in Rhode Island, such as Ethan Place and All American, where patients are mostly independent but have nursing support. While profitability is essential, our goal is to build a sustainable and ethical business model that supports responsible growth. Although SmartRx will cost more than the standard plastic pill bottle, we plan to launch initiatives that donate products to low-income nursing homes as the company expands. What we are seeking today is connections to assisted living facilities, medtech investment firms, and our recruiting advisory group members. Through collaboration and innovation, we hope to revolutionize the geriatric pharmaceutical industry. Thank you.
So if I'm having trouble remembering to take my medication, what medication I'm taking and when to take it or why I'm taking it, how is the pill box being filled and by whom?
Actually, talked to pharmacists about this, and our brainstorming idea, it's still in the process of it, is that we're thinking of either having the pharmacist fill it and having a 90-day supply, and therefore when they go to refill their medications, then a pharmacist will refill it again, or to have loved ones do it if you're in a situation where you have caregivers.
The size of your market and what indications you think are warrant starting first.
I think we're gonna start with piloting it in nursing facilities and see how it works and get feedback off after that. And then after that, hopefully to scale it bigger. But as for our target, we are looking for people ages 65 and up. And we're also looking for people who like have medication and are either at home. And like that's why we put the glossary in it so they can see what they're taking and have an understanding. So it's, and that's it.
Clarion.
Hi, my name is Griffin Kovac. I'm a current sophomore, and I'm building Clarion. Here's something that every student knows, but no one ever says out loud. Here's something that everyone knows, but no one ever says out loud. College isn't overwhelming because the work is hard. It's overwhelming because the small stuff never ends. A 5-point quiz, a homework worth less than 0.5% of your grade, or that random discussion post buried 5 layers deep in Canvas. It's death by 1,000 tiny assignments. And I felt the same way. It seemed like I was spending more time tracking my assignments than actually working on them. And when I talked to other students, it was the same thing. This wasn't a personal flaw, it's the system. And the data backs this up. Over 80% of students procrastinate, 80% feel overwhelmed, and 60% feel stressed almost every single day. Not because they can't do the work, but because they don't know what to focus on and when. And that's why I built Clarion, to lower procrastination, to cut the noise, and to free students so they can work on the things that actually impact their GPA. This isn't a mock-up. This is a working prototype with real live Canvas integrations. On the left are assignments pulled directly from Canvas, organized intelligently, and tracked the entire time. On the right is the What If grade engine. It allows students to adjust any of their upcoming assignments and instantly see how it impacts their GPA and their course grades. Layered on top of this are smart notifications, reminders that understand what needs to be done, when it should be started, and if the student has already completed it or not. We're also adding a motivational layer based on proven behavioral design. The earlier a student completes an assignment, the greater the reward. They can then use this money to customize a digital dorm room with their roommates. Most other tools do one thing, maybe organize assignments or show deadlines. Clarion is the only platform that has all of them in one place. Not to mention, these tools still have millions of users. Because we're in a lightly regulated space, there are a few legal things that we had to keep in mind, and they were built into the process the whole way, and we're doing pretty well. For students, pricing will be between $4.99 and $9.99 a month, or between $19.99 and $29.99 a semester. We'll also offer institutional licensing for campuses. And at 20,000 users, which is the equivalent of 0.1% of US undergrads, Clarion will reach $1 million in annual recurring revenue. Companies in this space typically trade at 5 to 10 times their ARR, which validates the opportunity. And our plan going forward is simple. We're going to start with a free Providence College pilot that's very scoped. We're going to collect as much feedback as possible, and we're going to iterate the product from there. And because Clarion only works in schools that were a verified Canvas vendor, our growth strategy is one school at a time. And we're going to be doing that through student ambassadors, targeted performance ads, referral loops, and organic content. We're looking for funding so that we can complete V1, polish our core features, and to support the pilot. We're also looking for advisors with EdTech or SaaS experience, as well as introductions to CIOs or technology teams at Canvas institutions? Thank you. I'm excited to answer any questions.
Tell us, are anyone using this now? So you've built it and it exists. What do you need to do to launch it and to get the pilot up and running here at PC?
Yeah, so right now, we're trying to just make it a little bit more accurate because we want to make sure that all the inputs are outputting exactly what we want them to. They're already doing pretty solid. And then also, we need to finalize some of the legal stuff, like becoming legally liable for any data loss, and then filling out the FERPA and HECVAT forms. Thank you.
There we go. Can we just do one more round of applause for these amazing teams? You did fantastic. Incredible job. Very proud of you. So next up, we are going to do the Audience Choice Award. There are QR codes on your tables. You can only vote once, and we will know if you vote more than once. For people who are live streaming, you should have the QR code on the live stream. So please vote from afar as well. And you should see a little brief description of the team so you have a little reminder of which team is doing what. Just take a second. I know it's a very difficult decision. Oh, and you can vote for yourself. In fact, I encourage it. Thank you, judges. Yes. Okay, why don't we take a 5-minute break while we set up for the fireside chat, and then student teams, you must be starving, so go grab some food really quickly, and then we'll move on with the fireside chat. Chat. Go ahead and get your food, but if you don't mind just being a little on the quieter side.
Testing 1, 2, 3.
That's fine. Whatever's. Yeah, just start. Why not?
All right, we're sitting here with Keith Price. Keith is a co-founder and co-CEO of Aquest Group. The company specializes in the acquisition, management, and expansion of technology-driven companies in consumer insights and marketing services sector. Founded in 2024, Aquest creates human-verified data with AI to develop insights for businesses. The company operates globally with a staff of over 200 employees. Keith is an entrepreneur with a passion for driving innovation to create customer-focused organizations. He has over 25 years of experience in building and leading technology-based businesses in the insights and data intelligence industry, consistently delivering outstanding results in growth and operational excellence. Before Aquest, Keith, along with Hugh Davis, founded Reimagine Holdings in 2011, a premier global insights provider dedicated to simplifying the creation of insights for fact-based business decisions. Reimagine operated globally with over 250 employees and $100 million of revenue before it was acquired in 2019.
And thank you so much, Keith, for being here today. Our first question to you is, can you tell us a little bit about your professional journey after graduating Providence College and how you've gotten here today?
Sure. First of all, I thought great job to everyone today. You deserve a round of applause. I know it's tough getting up here in front of your peers and in front of adults and talking about all of these new businesses, but I thought everyone did a terrific job. You know, it was interesting. Today we had our Ryan Incubator advisory meeting. We had a handful of students, I think a couple that are in this room that were in there. And one of the questions that came up, or one of the things that came out of that meeting was, gosh, I'm so nervous to get a job. I'm so petrified, will I get a job? I just need to get a job. And I heard a couple times over and over, I just need a specific job, safe job. I heard the word safety a number of times. I heard the word, I just need to get that safe job. And I think back to the question of my career and how things unwound throughout my career. I studied finance at Providence College. I had no intention of ever going in finance. I never thought, oh, I'm going to go to Wall Street, or oh, I'm going to be a CFO. I just felt like understanding financials would make me more successful in whatever I did throughout my career. And I can think back to those first days of interviewing and saying, what am I going to do? What am I going to do? And I remember distinctly I had two options. I had the safe one, which was large company, Merck Pharmaceuticals. You get a company car, you get a good paycheck, you get all these things. And then I had this little $10 million data company where I was fortunate enough to interview with the CEO. And the CEO said, don't go there. Come here. I'm going to teach you this data business, and trust me, it's going to be much more interesting than going down that safe path. And I remember my parents and even my girlfriend at the time, they're like, you're crazy. Don't take that job. That's going to be crazy town. I've never heard of it. It's too small. And as I look at what happened throughout my career, taking that risk and going not down the safe path, but quite frankly, one that was more interesting to me and more energizing, it really started that journey down the road of where I am today. So I'll just give a brief background on my journey, and I think it applies a lot to what's happening today. So when I started in my career, it's kind of like today with AI, but it was called the internet. And the internet was, oh, who the heck is on the internet? It's all these geeks. It's all these, weird technical people. No one's ever going to adopt the internet. No one's going to always be on the internet. It's not going to connect the entire world. This is back in 1994. I joined a company, and my entire career is creating data for businesses to make decisions. The traditional term is market research. How many people have studied market research through their business studies, right? Asking questions, asking people, why did they do something? And I had this super exciting 10-year run where we took all research that had been done historically, calling people on the phone or tackling them in the mall. People probably don't even know what a mall is anymore in this room, but there used to be these things called malls, and people used to go there. And that's where you'd intercept people and say, are you going to go to the movies this weekend? Are you going to buy a new car? Why are you going to do that? Or they call people on the phone and say, Can I bug you during dinner time? Can I ask you a few questions? So I joined a company called Greenfield Online. This was in the mid 90s. And I had this awesome experience. It was from a startup, venture backed. We took the company public in 2004 when we realized that, wow, this internet thing really does work. We can communicate with people over the internet. And basically, I went through the first 10 to 15 years of my career where we moved all research, all surveying of people away from in-person and telephone. 100%, most of it today is really done via the mobile phone, or it's done via the internet, where we build large panels of the population. We learn as much as we can about those people, and then we survey those people over time so we can find out the why they're doing something. So I'd say the start of my career was following what was more interesting to me and not taking the safe route. I think that's an important theme. I encourage everyone in this room, as you're looking at your career and what you think you're going to do, if you see something that's interesting, take that risk. Don't always take the safe thing, because I can tell you right now, I would not be sitting here where I am today if I took that safe route and I really followed my passion at that time, which was just something that very much interested me. As I sit here today, I've been very fortunate that I've built a couple businesses in this space that have leveraged the ability to survey people and gather opinions and sell those to corporations. And I think each one of you in this room is in an amazing position where I think back to the internet. It took 10 years for the internet really to become viable, a viable business model, it just took long for everything to stick. And as you know, everyone in this room, AI is happening so much faster. I mean, it's happening what took a year is taking a month, if not a day. And I think as it applies to half the presentations today use the word AI. It's amazing what that's allowing people to do. And in my business of delivering insights, we're leveraging artificial intelligence to predict outcomes without even asking people questions. So think about some of the things that we saw today. Can we take some of those concepts, feed them through synthetic personas, and predict outcomes? How many people will actually download that app? How many people will actually use it? That's the world that I live in today, and it's one that I think has such possibility, especially as we can do more things with more information.
Thank you for sharing. That's really awesome to hear. Would you mind sharing a kind of a highlight and then like a low light or a challenge that you faced during your career?
Sure. So, okay, so let's think. I'll tell you a low light. Low light was in 1999. We had raised $60 million. Not we, but the board had raised $60 million to start this company, Greenfield Online, and came to Friday I remember a Friday afternoon, and we had burned through all the cash. Bad CEO at the time that ripped through all the money. And we went into New York City, had to go to our investors, large private equity firm now today called Insight Venture Partners, and asked them for $500,000 to make payroll. And if that payroll was not made, we were dead. The whole thing was going down. Now, fortunately, we had changed the business model. We had replaced the CEO. I was on the executive team, but it was really that close to not being successful. Fortunately, we had good financial backers. They wrote the check. They saw the vision of the new CEO. They saw the model, and they were well rewarded because, not 4 years later, the company, went public on the NASDAQ. So, that was probably the highlight, was ringing the bell at the NASDAQ. That was a pretty exciting moment.
Yeah, definitely. And thank you for sharing that as well. We talked a little about your company, your current venture, AquaWest, that was founded in 2024. Do you think you could tell us a little more about it, maybe what inspired you, what your goals are, and where you see AquaWest heading next?
Sure. So one of the foundational things that got us excited was AI and the ability to evolve the product and the offering. So I took some time off. I did some research in the market. I have a partner, Hugh Davis. This will be our third business that we're working together. So that's really exciting that you can work with the same person and have successful outcomes. We had a great team that we were able to put together. And what we did this time, which was a little bit different, we built a tech stack to leverage AI for operating the business more efficiently. And then this time around, we acquired a couple companies. So the idea here was to take AI, do some acquisitions, and then put those together so we could grow more rapidly. So I know there were a number of opportunities in the pitches that involved medical or healthcare. So one of the things that we acquired this time is we acquired a company that has 75,000 physicians that are taking surveys. So that's a really valuable group. You can imagine how much value there is in that audience. So it's really cool that we have a very unique data asset. There's huge demand in the healthcare segment for surveying any type of healthcare category, whether it be patients, physicians, givers, payers, across the entire spectrum. And what we're doing that's really cool is I'm taking this database of physicians, I have all this information that they've answered over time, and then we're overlaying AI to, again, predict outcomes without necessarily having to ask questions. And then part of the vision here as well, which is very early days, I predict some of our largest customers in the future will be just large language learning models, because the models need a constant feed of information. Sentiment is changing, everything's changing rapidly on a daily basis. So when we look at the company today, most of our customers are corporations that want to make better business decisions. It could be Eli Lilly, it could be Kimberly-Clark, testing different products and services, making different and predicting different outcomes. But I think you're going to see a world where we will be, in my business, our data will be feeding models that will help make decisions without having to ask, or asking just the critical questions. I always say it's interesting in my business, I think of the world, think of it this way, if Google organizes the world's information, we create data that does not currently exist. That's the way to think about market research or insights in particular. So we're typically answering the why question. We can track behavior, we can track purchasing, but we're trying to answer why does someone do something? So it's just like, why would someone have put a wearable on to track their medical, when they're supposed to take a pill? What's the motivation that's going to make someone, download an app to make their life better? Those are the things. And a lot of what we also do is leverage our data to help people like everyone in this room to pitch and raise capital. So I loved seeing some of the research that was there today. Most of it's secondary research, but one of the things that my company does a lot of is primary research, where someone says, I'm going to go in, I want to raise $250,000, I want to survey, here's my target audience, I need to survey 250 people, and then to have that data in hand and deliver it to an investor group and say, look, 80% say they will purchase this product at this price point. That's powerful. And what's cool about the digital availability is research and insights used to be really labor intensive. As I mentioned, it was calling people on the phone. Now I can launch a survey on my phone, and I can have data. I could have data back within 30 minutes.
You mentioned that you started your third business with Hugh Davis. What are some qualities maybe that he has, or just in general, that you would look for in a partner or an employee or just a friend in the business world?
Great question. So, I remember when we first started, when we raised capital, the question was co-CEO. That's death. That is a disaster. How are you guys going to make decisions? What happens when you have a fight? What happens when you don't agree with something? And I can tell you, I've been very fortunate that I think the one fight we had in our career was, where to have the Christmas party. Like literally, that was like a big issue we had with each other. So we worked together before we partnered together. And then we had the benefit of, because we had a working relationship and we understood how we operated, I'm more of a commercial person. He's more the technologist. So we definitely have our lanes. We understand how the lanes work, but we're very collaborative when we're making business decisions and looking at things. And when you do it a couple times, we had a successful exit, so that's great. So then to naturally do it again, it wasn't hard. We've always said we'd never be in business without each other. We're always working together. And then to the second point of your question about employees, and really this is advice for everyone in the room, my number one trait I look for in each of you, if you were asking me for a job, is curiosity. Like curiosity, I can't teach that. You either have it or you don't have it. And that is the number one thing that I look for in people. And those that have succeeded working for me through my career, that has been the trait that's been most important to me.
Yeah, totally. And I think a lot of people benefit from hearing that from somebody who's been in the field for so long, that really having these curious thoughts and wanting to take those risks, like you said earlier, is really what makes people stand out. When students are maybe looking for a job, especially in this very competitive job market, do you have any advice for them? And going off of that a little bit, how do you see in-office, remote, or hybrid work kind of coming into play with that?
It's one of my favorite questions. I guess one, with curiosity, don't be afraid, right? So it's those people that knock on my door, call me on the phone, hit me up on LinkedIn, those people that are persistent, you just have to go for it. So don't be afraid, right? Take the initiative. It's interesting. I find I hire a lot of my best customer service people always come from hospitality. It's usually from the restaurant industry. I don't know how many people started out the waiting tables, bussing. My first job was in the back of the house washing dishes, and then I became a busboy, and then I saw this really cool thing. You get a tip for doing a good thing. You're like, wow, that's interesting. And then become a waiter, and you get a bigger tip. And I can't tell you how many, some of my best hires, I'm at, having dinner at the bar, and I see someone that's delivering tremendous service. And I always say, I'd love to hire you, but it's on you. You have to call me. And those that call, I always give them an interview 100% of the time. But you know how many people don't call? And they should. So my message, so you definitely cannot be afraid. You have to make sure you take that initiative and go for it, because you won't know unless you try that.
With kind of the new digital age, you see a lot of people working from home and stuff like that. Do you see any implications on that of kind of building a workplace culture?
Yeah, so that was part B of the question. So we struggled with this one over the past, I'd say 9 months. We've had lots of challenges about what do we do? Do we Jamie Dimon everyone and say you got to be in the office or you're out? Here's your severance package. Bye-bye. Good luck. We can't do that in our industry. It's too small and it's too much of a disadvantage competitively. So our philosophy, and I speak a lot about culture because I think this is really a culture question. So our view is, it's interesting, like we have an employee handbook that's this thick, but the one that I use is one page. It says adults work here. And that's kind of the philosophy of the company. Like, come on, do we really need a handbook, for silly things? Adults work here. Now, when it's your first job, I get it. You're not quite an adult yet. You don't know what the social cues are. You don't know what you should be doing. But we know, based on our experience, in general, we want people together. We think people deliver magical solutions, whether it be customer service, product, whether it be back of the house in finance and operations, front of the house in sales, product development. We just are better when we're together. So our goal, one, is to inspire people to want to come back to the office. So what does that mean? We've made sure that right now we have 10 offices around the globe. Our largest office is outside of Philadelphia. We have 75 people, and when COVID hit, they stopped going in. This was an acquisition we made. We acquired that company in March of this year. There's still 75 people that never come in. So we revamped the office. We made sure it was a great environment, made sure the coffee is the best in the world, all the basic silly things. But really, it's on us. So we have to get the managers to come in to inspire the people that work for them to come in. And we want to make sure that it's somewhat natural. But if you need to pull out the employee handbook part, we're going to require 3 days a week is what we're launching January of this year. We're going to ask everyone to come in at least 3 days a week. And again, our environment, our culture is, if you have something that's important to you and you need to stay home because the repairman's coming to the house to fix your fridge, that's fine. Just do it. And in our business, people are kind of connected 24/7 anyway, between their phones and their computers. They're always somewhat connected to the environment. But I do believe we're missing everyone in this room. My other advice is, if you have an option between a job that's in the office and remote, get to the office. You are going to be so much more competitive. You're going to learn so much more. I believe we're losing a whole generation of employee to this remote stuff. And again, I get it. Some jobs are remote. By definition, they have to be remote. But I think that there's the power of being together, greatly outweighs, being remote, but with flexibility. Like, we don't want to be punching time clocks. We want to make sure people have flexibility.
Yeah, definitely. I think I had an internship over the summer and it was all remote. And I think the number one thing it actually taught me is that I wanted to be in person, just because I felt like I couldn't necessarily connect with clients or connect with even my team members. Kind of switching back to your company, AquaWest, your company helps the expansion of other companies. In your experience, what have the most successful companies done to kind of get into the market and get noticed by clients?
Yeah, so if I look at my clients, it's clients that use data to make decisions because data is everywhere and it's very readily available. So we have all different types of use cases and all different types of clients. One that's more interesting and engaging in this room is we do a lot of work in the entertainment industry. So if you think every single show that Apple, produces, or Amazon or Hulu, we test all of that content. So that starts with storyboarding, here are the ideas, targeting audiences, asking if they would watch the show. Then they do test runs of the show, and then we preview those. In the movie industry, we test for Paramount and Sony much of their movie trailers. So before the Avatar trailer comes out, I guess there's another Avatar coming out in December, I think. We tested those trailers. So we'll show a population, and then we'll segment it by age, by demographic, by region, and then the studios will use that information to determine, what to push, what to go forward. Now, on the new product development side, we do a lot of research testing any kind of new product. So it could be a product line extension, so a new flavor of potato chip or a new type of beverage. We'll do that type of testing. And then in some cases, believe it or not, we have physical locations where you can't test over the doing something over the phone or doing something over mobile phone or internet. In some cases, we actually have people come into central locations where they have to taste, touch, feel, hear something. They'll actually look at a physical product. But really, the answer is any company can leverage data to make better information, better decisions. And if you're not taking advantage of that, I don't care whether you're Fortune 500 CEO or now mid to small market, the data is readily available and it's accessible to everyone.
Yeah, absolutely. I definitely think that data is the key to a successful startup and or business. Did you have any pitches today that you saw that really used the data well, or that you just liked in general, out of the, I guess it was 12 that went today?
I mean, I definitely, anyone who's in the healthcare segment, we should definitely talk. I think I may be able to help, because we do have patients, we have all different categories of caregivers. We have physicians, they're all impanelized. And I think, the idea of using technology and using solutions to help with, management of all this, I think everyone hit it right on the head, this aging population. You have a demographic that's going to create a huge market opportunity. It's a very inefficient and cumbersome system. There's frustration across up and down the chain. So I think that category is going to be hot. It is hot now, and I think it's only going to become more robust. So I'd say, that's a category that if anyone, I'll be here for a while. If anyone wants to chat, audience that you're dying to talk to, let's chat off of this chat.
Well, thank you so much, Keith, and I'm sure everybody in here appreciates your advice and what you have to say. We just want to say thank you again for having this fireside chat. And now I think it's time to hear the winners of our entrepreneurship competition.
Thank you.
Be our winners today. So thank you all for your time and effort. Third place, Preva. I think we really like the idea of that using existing devices to apply to a problem is a great solution instead of trying to build more and new devices. Second place, Clarion. A solution we could all use, even in my own life, having an application that can help me sort the things that are going to have the most impact on my day or my GPA or my salary, whatever it is. I think there's applications well outside of every college in the United States. And first, a worldwide application that we believe is cost-effective, impactful, and ready for immediate success, Safe Mother Patch. Congratulations. And that's all I've got. Congratulations, everybody.
Just a reminder, prize amounts, third place, 1,000, second, 2,500, and first is 5,000. And now we have the 500 audience choice. Thank you.
Just want to congratulate you guys all. Great presentations. So with that being said, the audience choice vote goes to Clarion.
Okay. But let's all stay in touch. There's also the Ryan Incubator Grant Fund. So I'd love to talk to any of you who are really committed to moving forward with your ideas. There are other funding opportunities. And again, thank you for being brave and stepping up and working so hard. So I look forward to continuing to work with you. And thanks again to the judges and everyone that made this event possible. I want to also thank Meg Turner and Emily Sinan, who really just did so much work to make this event possible. And special guests, we have a lot of our colleagues in institutional advancement, and we have Dean Watkins. So thank you for joining us today, and have a great evening, and you can now relax.